firm. Small businesses are facing even more dramatic challenges. David Allen runs a medical billing firm in Boulder, Colorado. When he went to move his employees onto a state exchange plan, he was looking at either a 52% hike in their premiums or telling the staff they faced a big jump in their possible out-of-pocket costs. David joins us now with the rest of his story. David, thank you for being here. And so you have a business that has under 50 employees, so it's not required to get insurance for, its employees. Why did you decide to look into this?
Well, we've provided health insurance to our employees for many years. Long before the government said that they expected us to do this, we've taken this burden upon ourselves because, quite frankly, we can, and we feel that it's the right thing to do. So, regardless of the number of employees that we have, this is a commitment that we've made to our employees. The problem is that it's getting harder and harder to keep that commitment because of the excessive increase in the premiums as a direct result of the Affordable Care Act.
So you're there, you're employing these 34 people or so, you decide to give them health care coverage because you're a kind boss who believes in insuring your people, and sort of just sitting there minding your own business, your premiums get jacked up as a result of the law. By how much?
52.3% to be exact.
And so what as a businessman, how do you evaluate that?
Well, you can't. I mean, obviously a 52.3% increase is unmanageable. I mean, this is my second highest expense item after personnel. So I can't pass it along to my clients. I can't absorb it. It's really unmanageable. So, we did the only thing that we could do under the circumstances. We renewed early. The stipulations under the Affordable Care Act are for plans under 2014 and forward. So we renewed 2 months early.
So you got sort of a 1-year grace period, but this problem is
we kicked the can down the road.
You're coming up on this problem. So what will you eventually decide to do? You're going to raise the premiums, or are you going to fire people, or what are you going to do?
Well, the jury's still out on that. I mean, we're certainly hopeful that someone in Washington will develop some common sense and come back with some alternatives that enable us to do what we need and want to be able to do for our employees. Short of them coming back and offering any concessions, such as allowing us to keep the health insurance plan that we had and liked and would have preferred to have kept, short of that, we'll either end up having to pass along a substantial portion of the increase to our employees, or we'll have to increase the deductibles or make some other substantive change because, again, I simply can't absorb that increase, and I don't have the luxury of passing it along to my clients. So, one way or the other, my employees will inevitably end up participating at a higher level financially going forward if we don't get some kind of relief from the federal government.
We have heard that story time and time again. David, all the best to you.
Well, thank you. Thank you very much.